How would you rate the training?
I would rate it quite high. So if it was out of 10, I would rate it between an 8 to a 10. Reason being, as I said, it's very relevant to obviously our post, and with all the practical examples that the trainer was obviously using, I felt as if the examples and what a person should do in terms of their response is something they can do on their day-to-day workplace. So I would definitely rate it high.
Can you name one thing you found particularly useful in the training?
I found the scenarios really useful. I mean, I know the trainer Joyce, she gave some scenarios, she obviously handed out some scenarios about things that actually happen on a day-to-day basis or on a week-to-week basis. And then obviously as a group, we sat down and we spoke about, you know, can we identify the potential harm? And then we spoke about what we should or shouldn't be doing. So I found that very useful.
Okay. How have you been able to apply what you've learned from the training in your daily work life?
Well, I mean, I've been obviously working in the field for like up to 7 years. So for me, it was really beneficial in terms of a refresher. Because sometimes when you work in a workplace, you end up forgetting things that you might have learned years back. So for her to obviously sort of categorize the different types of abuse, etc., and then also talking about statistics. Because a lot of the times when it comes to when we're talking about harm, and obviously it was around safeguarding, she was mentioning that most of the safeguarding or potential abusers are people within the circle. So again, it was really good that, you know, she obviously provided that information. Obviously we were given course notes, etc. So we can always refer to these sort of things in order for when it comes to refreshment. So
would you recommend the training to others?
I would. I mean, I think this training is universal and it should be definitely recommended. I mean, I would make it mandatory to everybody, because obviously it is mandatory in general, but I would definitely recommend the course instructor as well as the training itself, because the content and the way it was delivered was really good and it was really engaging. You know, that's what you want a training to be like. You don't want obviously the instructor to sort of just tell you information and then you go away after a few hours. It was engaging where obviously the individual was speaking to us, letting us speak as well, share ideas and share taboo scenarios, because that's what we were doing. So yeah.
If you had to recommend it to anyone, is there anyone specific you would say you'd recommend the course to?
I would recommend it to all people, not just frontline staff. I would also recommend it to even social workers, and I would even recommend it to managers of that obviously manage services, because a lot of the times, like I said, if managers are aware of these sort of things, they can then cascade it and delegate that information to their frontline staff. A lot of the times these trainings are generally provided to frontline staff, and managers or other professionals miss out. So, and I would recommend it to all people, as well as the service users themselves. So if, for example, we're supporting adults, or even families, parents, they should also be aware of these sort of things.